Hello, I'm Joan Justice, and I'm here today with Dr. Joel Selanikio from the DataDyne Group. DataDyne created Magpie, an award-winning mobile data system that's used by about 20,000 people worldwide, including the World Bank, the CDC, the Red Cross, and some others. Since Magpie is designed to require no training or programming and it's based in the cloud, it cuts down on costs and is readily available for use by anyone. Dr. Joel Selanikio is a practicing pediatrician, former Wall Street computer consultant, and a former CDC epidemiologist. He's also founder and CEO of the DataDyne Group. Dr. Selanikio, tell us a little bit about DataDyne, Magpie, and your mission in regards to data collection in mobile health.
Sure. First of all, thanks for having me.
Sure.
So DataDyne is about 10 years old and was founded by myself and my business partner, Rose Donna. I used to be, as you mentioned, with the CDC. I was a medical officer, epidemiologist, and focused on a variety of things, but including malaria in Africa and data collection around that. And Rose Donna was working for the American Red Cross and focused on data collection for measles. And both of us were involved in technology projects trying to use things at the time like PDAs. For those in your audience too young to know what that was, it was like a mobile phone without the phone part. And we were working on projects to use those things, and we decided maybe if we joined forces and created our own organization, we might be able to move forward faster. So DataDyne's been around for about 10 years, and I would say that the mission of the organization, the mission is to change the way things are done in global health and international development in one particular respect. And that is, right now, whether you can collect the data that you need to manage your organization, or whether you can collect the data that you need in order to establish the baselines for certain diseases, whether you can collect the data that you need to know, for example, how many children need to be vaccinated in a particular country, whether or not you can get information to answer any of those questions or the other important questions or to manage your supplies, right now that capability of measuring those things is inextricably linked with how much money you have. Mm-hmm. And if you have money, as is quite commonly the case, if you have money, you can have all the technology that you want. That is to say, if you have $1 million, or you can get the Gates Foundation to give you $1 million, you have no trouble, let's say, collecting data electronically. The question is, what if you're an NGO that doesn't have that money, and doesn't, or perhaps doesn't even have any technology budget? What if you don't have programmers on your staff who can adapt many of the widely available projects that require programmers? If you don't have those things nowadays, and of course people who don't have those things, money or programmers, is the vast majority of health organizations or international development organizations, the enormous majority of them don't have that. That means you can't get the technology, because the technology requires money. That money is used to either buy the software or to buy the people who help you set up and run the software. And for me, as a public health doctor, just as with the discussion and debate about health insurance in the United States, where people say, you know, health is a human right. Just because you're poor shouldn't mean that you can't get health care. And I think just because you're poor, or a poor organization, or not funded for technology, should not mean that you cannot manage your programs or collect the data that you need. So the mission of DataDyne really is to identify certain technological needs that we feel are key for the operation of international development organizations and ministries of health, etc. Identify those things, especially the ones that currently really aren't being widely used. And the reason they're not widely used is they're too expensive or complex. And to make those things simple and inexpensive. And the first target we aimed at, because of my background and Rose's, was data collection, recognizing that the vast amount of information that we should be collecting for international health, for example, never gets collected at all. And of the small amount that we do collect, it's almost entirely still collected on mobile phones, on paper, even though we've had mobile phones widely available for 15 years. We've had PDAs available for 5 or 10 years before that. We have the technology, but unfortunately, as I said, the technology is too expensive and complex for most organizations to use. So with Magpie, what we've tried to do is basically say, we're going to look at this data collection, we're going to identify what are the major costs in using this technology, and we're going to get rid of them. And we're going to get rid of them by using the same approaches that are used by international commercial organizations. So, for example, most technology that's used in international development, one of the reasons it's expensive is it requires a lot of programmers or technicians to set up and to maintain and to operate. Well, those things are expensive. So let's make the software so simple it doesn't require any technicians or programmers to set up. The second thing is most of the software requires it to be set up on a server that you have in your building or that you control. Well, those things are expensive. So we eliminated the need for you to have your own server. We base Magpie in the cloud. This approach of making things so simple that you can do it yourself and having everything cloud-based should sound familiar because it's the way that we use that all the software we use in our personal lives happens. I mean, as we were saying, with the exception of Microsoft Office, what software do you install on your computer lately? Like lately meaning the last 5 or 10 years. Nothing. You go to websites, you get things on your mobile phone. Everything is mediated via the cloud because it's cheaper. Everything is made so simple you can do it yourself because it's cheaper. So our first goal, again, with DataDyne was really to identify that data collection is a critical aspect of a functioning health system or public health system. And yet it's not happening in most cases. We're going to plug that hole. Our second goal, I think, right now, which we're starting to think about with the success of Magpie, is what other technological needs are out there that are not getting done because they're too expensive and complex, and how can we apply these lessons? I was going to say the lessons of Magpie, but really the lessons of Google and Yahoo and Hotmail. How can we apply those things to those new problems?
Yeah, I know. I saw the website. It's download it, go and collect your data. It's simple and easy, and it's free. Which is absolutely wonderful. Tell us a little bit about the projects. I saw some of the projects on your website, the IRC project, for instance, and the Camp Fed project and the water project. Just tell us briefly about some of the people that are using Magpie.
Sure. Well, one of the ironies, I mentioned that part of the way that we make Magpie so cheap and free in most cases is by eliminating the need for us to be involved, essentially. I mean, our software is involved, but we're not. So, in just the same way that somebody at, let's say, Facebook, doesn't necessarily pay attention to what you put on your Facebook page, right? And you don't have to go meet with the Facebook people or tell the Facebook people what you're doing.
Luckily,
in order to use Facebook, it's the same thing with Magpie. And so, kind of a bittersweet aspect of the success that we've achieved in scaling mobile data collection has been that for most of the people who use Magpie, they never, ever need to email us or notify us of what they're doing. I kind of wish they would many times, but I recognize that it is the price we pay by recognizing that having to speak to us or inform us is an obstacle to scale. But of our paying users, so we've got about 20,000 users worldwide of the software in about 170 countries. Less than 1% of those users pay. But because the users who pay often pay us by wire transfer or some method by which we do need to talk with them, and some of our users require us or ask us to provide customization or something else. Again, this is less than 1% of the 20,000. Those users, we do know quite a bit about what they're doing. And just the other way we find out about what users are doing really is by Googling Magpie data collection on a regular basis, and we see what comes up. A great example of that. There's a group called Internews, which focuses on access to news, particularly in disadvantaged populations. So they focus on many other things, but they apparently wanted to do a survey in the Dadaab refugee camps in the north of Kenya. This is where you have refugees from the north of the border who are coming down into the country. And they apparently heard about Magpie, started using it, used it, the free version, did their survey, no cost. And we would never have heard anything about it except that we have this Google search that happens automatically that looks for the word Magpie. And when I saw it, they had a nice video online about them using Magpie. We didn't know anything about it. So I contacted Internews and I said, hey, fantastic. We're so happy you guys were able to use it and it gave you some value. Can you tell us more? Can you give us some pictures we can post on our website? And that's really how we learned about most of it. One of our paying customer organizations, IRC, the International Rescue Committee, they've used Magpie for a lot of different things. Been using it for years now. But one of the things that I love is they came to us and they have a project in Sierra Leone where they train and equip and support in many ways community health workers. And the community health workers obviously provide healthcare services within their villages. And IRC basically needed to get information from those community health workers. How are they doing? How many kids are being born? How many births are you attending, etc. And they were using the Magpie application. IRC would send people out, at first with paper forms on clipboards, from like the IRC central office in Sierra Leone. They'd send them out to all these rural villages, and they'd collect information on paper, and then they type it into a computer. Well, obviously that process could be improved, and they used Magpie to change that. Instead of sending people out from the central location with paper forms on a clipboard, they switched to sending them out with a smartphone running Magpie. But then they said, something interesting has happened, and this is such a reflection of these amazing, miraculous changes in technology in our time. They said all the midwives have, or the community health workers have mobile phones. Why can't we have them send the information to us instead of having to drive out to these villages, which is expensive, and there are security issues and the fuel cost and of course the time spent. And so we worked with IRC to develop a way where people could send, where literally illiterate community health workers could send in simple information, simple but crucial information, incredibly valuable information, via just a plain SMS, not from a smartphone, but from any phone. And so, IRC managed to create, with our help and us working with them, we managed to create a system whereby a midwife or a community health worker sends a text message that has, for example, the number of births, a number representing births, let's say a 5, and then a hash sign, a pound sign, and then the number of deaths in children. Well, I can tell you that you can't find countries or ministries, etc., that have real-time measurement of births and child deaths any place in the world outside of the rich world. You can't find it. Yeah. Well, IRC has such a system in Sierra Leone that's nearly countrywide, and the system, it's not only amazing in this world of miracles that we live in with mobile phones and the internet in general. It's not just amazing that it happens. What's amazing, and this argues about the issues of how can we get this stuff to spread, is that it costs IRC about $5,000 or $5,500 a year to operate this system countrywide. I mean, $5,000 a year, that's like one consultant's airfare, right?
It's great.
But they're actually able to do that at such a low cost, I think is just really remarkable. And this is one of the reasons, again, why people like Magpie. John Snow Incorporated, JSI, they use Magpie for lots of supply chain management programs. For example, with the president's, both the president's malaria initiative and also the president's plan for HIV, PEPFAR. They track medicines and supplies, etc., tracking them electronically on inexpensive phones in poor countries. Again, outside the field of health, because at this point, since Magpie is available online to anybody who wants to go use it, the only obstacle to people using it really at this point is hearing about it. Mm-hmm. That means that because we're health people originally, most people who hear about Magpie are health people also. But others hear about it as well. So CAMFED that you mentioned, which is the Campaign for Female Education, that essentially pays girls' families to keep them in school. CAMFED, they track girls' attendance and grades and disbursements of money across 5 countries in sub-Saharan Africa. Again, they do this with the teachers sending in information on basic phones, not smartphones, but $40 phones, basic Nokia, basic Samsung phones. And again, the cost for all 5 countries combined is something in the range of $11,000 a year for all 5 countries combined. These numbers are just absurdly low. And I think that because we're managing with Magpie, it's not just a question of can you do mobile data collection with Magpie? Of course you can. But there are other methods. The real distinguishing point between Magpie and other such systems is that when you look at the total cost of operation, how much is it going to cost to set up? How many consultants or programmers will you need? Etc. Magpie by far is the only one that can deliver something that's free or close to free, or even if you're a paying user, that can deliver something that's just really, really, really cheap. It's great software, but the best part about it is that it's also extremely inexpensive to operate.
Thank you so much, Dr. Selanikio. That was great information about a really worthwhile product. Thanks so much for talking with us today.
It's my pleasure. Thanks for having me.
Bye.